Hello and welcome to McDougall's Medicine with Dr. John and Mary McDougall. I'm your host and their daughter, Heather McDougall. This is an hour where we're going to spend just answering general questions. I have dozens in a pile here that you've all emailed to me, and I know many, many more will come into the chat while we're talking this hour. So lots to talk about, lots to get to, but I want to first say hi to Dr. McDougall and Mary, Mom and Dad. How are you?
Oh, we're good. Yeah. We're a little tired. I'm good grief. We've been working hard running our 12-day program at the same time.
You're tired. I was just going to say, I've been Zooming all day.
You've been on all day, yeah.
We have a really, really nice group of people. And they're going to do well. I can't, so far I haven't really seen any serious problems that aren't easy for us to handle. And but that'll happen as time goes on. We'll get a chance to meet with you guys next Sunday. Maybe I'll be able to correct that. I'll tell you that there were a whole bunch of people with a whole bunch of problems that I was not able to solve.
Oh, never.
That never happens.
Well, it's just so stupid simple. I mean, people are suffering from food poisoning. They plain and simple, they are sick because they're eating a diet that you wouldn't feed to your dog or cat. You'd get arrested if you fed them, pies and ice cream and Coca-Colas. And
just think if we had supermarkets like that for dogs and cats, and we had to shop for our pets.
They're always pushing good nutrition. They're not pushing high protein diets, or they're just pushing good nutrition. In fact, the interesting thing about veterinarians is they know a lot more about nutrition of their customers than human doctors do. I used to have a radio show in Hawaii on KGU radio. It was the number one station in the Hawaiian Islands. And prior to my show, there was something called Pets and Vets. And they would always get on, they would talk about what, you feed the dog or the cat. They never cared what the dog or cat wanted to eat. They just plain and simple wanted their dog or cat to look good, feel good, function well, and not have to go to the veterinarian. So they talked about the best diets. And often would come up the idea that we need to feed, you've run across this, you dog owners have, particularly as your dogs get older, we need to feed Fido a low protein diet. And this is an animal that's clearly an omnivore, okay? This is an animal that's designed to live off a wide spectrum of foods, all the way from animal foods to potatoes, et cetera. That's what a dog is, an omnivore. We're true herbivores with some tolerance for whiskey, cigarettes, and pork chops. So anyway, it's just a sad thing that people don't really understand, or medical doctors don't understand what people eat. I think it's not a mistake. I think there's no financial gain. We just started the American College of Lifestyle Medicine, which is an organization dedicated to food. To getting doctors to practice diet therapy. We started that in 2004. Anyway, what kind of questions do you have, Heather?
Oh, I have so many. Okay, so I'd like to start out the first one. Can you talk a bit about volume eating? Some of us are volume eaters and we just don't know when to stop. So what sort of indicators are there? How can we know that we're full? What can we do so that we don't gorge ourselves?
Well, I think you can slow down. That I believe is part of the problem with volume eaters, is they don't get time to let the food register in their stomach. So what you could do is you could start planning more frequent meals, smaller meals, more frequent meals. Plan on what you think is a reasonable size meal, and eat that. Get up and go do some chores. Come back half an hour later, and have another plate full. And that way you've had time to let the food, turn into glucose in your bloodstream and, cause the insulin levels to rise and fall, et cetera. You will satisfy the hunger drive. All kinds of different hormones change when you eat a healthy diet, but, your blood sugar is certainly one of them. So it gives the time.
You have to put the food away. You could just leave it out there and just get up and to go do something and then come back and the food will all still be there. So if you wanted more, so you wouldn't feel like you were finishing dinner. You were just taking a little break.
Yeah, look at it that way. Or look at it, I get to have 2 meals today instead of 1, or 3 or 4 or 5. But yeah, that's what I would suggest you do is you pace it out a little bit. You don't have to consume a big hooping plate full of food like within 5 minutes and you're not in that big a hurry. Life doesn't got to go that quickly.
Well, I remember the days when you used to eat much faster
Yeah,
than you eat
I
right
ate a
now.
lot. I was
You
a
ate a lot
vitamin
more
too.
food,
I
but
was a
you
vitamin.
eat fast.
I did.
And
I
one
don't-
of our sons still eats really fast,
Yeah.
although he's slowing down as he gets older.
Right. Yeah. And I was a volume eater too. I think it had a lot to do with the fact that I really never took the time to eat.
You just wanted to finish it up and get out and go do something again.
Go windsurfing or something.
Yeah.
Okay, thank you. I think you talk a lot about eating smaller, more frequent meals and
Right. That surprises a lot of people, particularly, I come from a background of Seventh-day Adventists. Not that I belong to that religion or understand it. It's that I worked in 2 Seventh-day Adventist hospitals. Seventh-day Adventists believe in a vegetarian diet and maybe even a vegan diet. Ellen White established the church for the Adventists back in the mid to early 1800s. And at the same time, she introduced a dietary program for her followers. And she did this, as I heard the story, because her husband was sick. And it was a chronic illness. Don't know exactly what it was, but he was dying. And he went to the natural hygienists of those days. These are people who believed in a healthy diet to get well. And they taught vegetarian type of eating, natural hygienists. And Ellen White learned about how to heal her husband and felt that she ought to bring that over to her followers. But the point I was trying to get to is Adventists have a bunch of rules in addition to believing that you should be eating a vegetarian diet, maybe vegan. They also don't believe in drinking, smoking, or the use of any caffeinated beverages or fermented foods. And they also think it's wrong to eat between meals, which I could never understand. I could never support the idea that you're not supposed to eat between meals because, that again gets back to the grazing. We know clearly people who graze, say, for example, experiments done where people eat 14 times a day as opposed to 2 or 3 times a day. They lose weight more effectively. In other words, they lose more weight faster. They lower their cholesterol further than those people who would say gorge or have maybe 1 to 3 meals a day. So there's some real advantage to it. I don't know how people got on the idea that you can't snack between meals. Maybe it's because they snack on the wrong kind of food.
Yeah, snacks are usually considered the wrong kind of foods.
Right.
Not meals.
okay, thank you for answering that question. Next question. Can diet have an effect on your ears and your ability to hear?
Definitely. And this goes back to work done by Dr. Herbert Spencer. And he did some work back in the 1980s. He was an ear, nose, and throat doctor. And ear, nose, and throat doctors are interested in hearing loss, inner ear problems such as dizziness, ringing in the ears, which we call tinnitus. That was his particular interest. Well, he wanted to find out what caused hearing loss or other inner ear problems. And so what he did is he got together with some of his friends and they went around the world. They went to Europe, they went to various countries in Asia. And what they did is they looked at the incidence of other diseases as well as hearing loss. And what they found is a direct correlation between whether or not countries had a high rate of heart disease, which of course everybody accepts is due to diet, due to high cholesterol levels. And he found those same populations of people that had a high rate of heart disease had a higher rate of hearing loss, tinnitus, vertigo. And so Spencer came back and he reported this in the medical literature. He wrote several papers, and I have these scientific papers. One of them includes the study of his patients with high frequency hearing loss. And what he did is he put them on a healthy diet, compared to the diet we teach, not even close, but at least it was in a direction where the people were able to lower their cholesterol. and put him on the cholesterol-lowering medications available at that time, which were basically niacin and Questran. And what he found was that half the people got improvement in their high frequency hearing loss. And number one patient was him. He got sick. He got terrible vertigo. He was not able to get up off the floor to even practice medicine. And he thought about the things that he'd learned in his world travels, and he decided to change his diet and decided to take the available cholesterol-lowering medications. And he cured himself of this terrible vertigo problem. So with Spencer's work, you can look up Spencer and hearing loss, and you should have no trouble at all finding the articles. But it makes sense, doesn't it? When you eat the Western diet, it just doesn't affect the arteries to your heart. It affects the arteries to your brain, and to your legs, and to your penis, and to your kidneys. You've got 60,000 miles of blood vessels. Some of them are veins, some of them are arterioles, and some of them are arteries. So you got 60,000 miles, and they get diseased at a similar rate. It's just that the manifestation of closure of arteries to the heart is pretty darn dramatic. Like half the people die who have closure to the arteries to the heart. They have a heart attack. Half the people die. And they die within 24 hours. It's sudden death. So it's very dramatic, as opposed to, say, a gradual development of pain in your lower extremities. You have peripheral neuropathies, which are vascular problems, or you develop problems with circulation, and your feet start to die. You develop gangrene. This is usually quite a slow process that takes place, but it's due to the same underlying disease, and you develop problems with your inner ear. The same thing with your eyes. The eye has an artery, and the ophthalmic artery, and it gets plugged up, and as a result, the vision decreases. It's called macular degeneration. It's a dietary disease. It's the number one cause of blindness outside of diabetes. Yeah, well, I'm not sure. I think AMD, or age-related macular degeneration, is probably the most common, particularly in older people. Blindness. So that's the way it is. You close arteries all over the place, and hearing loss is primarily due to artery closure, not to listening to loud bands or getting a viral infection. I mean, these are possibilities, but they're not common like people who develop atherosclerosis in their arteries to their inner ear. Is it reversible? Yeah, it is. At least Spencer says it's reversible. I haven't had the opportunity to observe such in terms of hearing, but I have observed people who've had tinnitus, ringing in the ears, who, for years they had it, and they started the diet, and they reported that the ringing went away.
Well, I think we've had some people that told us they could hear better.
Probably. We never tested it.
No, we never tested it.
That's what we should.
That's what we have.
If we started all over again, I'd have measured a few other things besides blood pressure and cholesterol in our patients.
Okay, thank you. Next question. This is from Suni.
And I do want to mention something else.
Okay.
I would observe this because I'm their doctor, and probably because I'm a man. I can't tell you the number of men who come back to me and said their sexual function has returned. They no longer suffer from erectile dysfunction. Okay, in other words, a limp dick.
That has nothing to do with ears.
It has a lot to do with ears.
Well, not really.
It has to do with circulation, right?
Circulation. The reason that the penis doesn't get hard is because the arteries that fill the penis with blood. The mechanism of erection is this: is you have spongy material in the penis, and you got these bundles of spongy material, and they fill with blood, and the veins, they shut down so the blood can't leave the penis, and that's how you get an erection. And when you plug up the artery circulation, not only do you compromise the flow of blood, but you compromise the nerves that control the flow of blood. And in that way, you get impotence too. But I was going to say, I may have had the hearing measurements that I should have taken.
That one.
But I can't tell you how excited so many
true.
relatively young men were to tell me about their new life. Things were working well. They're sticking with the diet.
Thank you for adding that.
This is well-known stuff, except you don't have the after part. You've got the before part. I mean, there are worldwide campaigns that tell you that atherosclerosis causes impotence. They often refer to smoking cigarettes, which is an aggravator of atherosclerosis. You'll see those kinds of ads. You have somebody with a limp cigarette in their mouth, and that indicates something else is limp. Well, there's an advertising campaign out there. It was started by PCRM, Physicians Committee for Responsible Medicine, Neil Bernard's group, and they put out an ad campaign in national media, which showed people eating the Western diet. They ended up having the same problem. But you got the after part.
Okay, moving on. This next question is from Sunim, and he is an 82-year-old man, 6 feet, 157 pounds, eats a plant-based diet with no oil or sugar, and is wondering how much protein he needs.
Well, you can't miss. I mean, as long as you're eating whole food, you'd have to design a diet made of table sugar or maple syrup. Something that is just pure sugar and no nothing. You can't miss. How much do you need in terms of actual amounts? You need about, well, at most, the scientific data shows, and also worldwide experience. And I'll tell you about that. The calculations are that you need about 3% of your diet as protein. Okay, and I look at it in terms of percent of diet, because you could eat a 2,000 calorie diet or a 1,000 calorie diet and so on. It's the percent of the protein or protein calories is the way you figure this and count. So recommendations are from the World Health Organization that you consume about 5% protein. And if you're pregnant or nursing, 6% protein. But otherwise, as a child, 5% protein. And part of that figure came from the fact that at the greatest time of growth in a human being's life, but when they're babies, they double in size in 6 months. The ideal food, no one will argue this, I know you won't. The ideal food for a baby is mother's milk. Mother's milk is 5% protein. Anyway, in Papua New Guinea, they live on sweet potatoes. The sweet potato, depending upon which chart you look it up in, are somewhere between 3 and 6% protein. This is a population of people who've lived for, at least 1,500 years on those islands, who fought battles, who did athletic events, who had babies, who worked hard on a diet that was 3 to 6% protein. Regular potatoes are about 10% protein. Rice is 8%. Oatmeal, 16%. Beans, peas, and lentils are 28 to 30%. I don't know how you could miss.
Well, but you see, I think that people don't think of those foods as having protein in them.
They grow horses.
I know they do, but people think about protein as being meat.
Well, that's because there's an industry out there called the cattle industry and the egg industry. What they've done, we've talked about this many times, but it deserves repeating many times over. These people are acting just like any good business people would act. And that is, they're trying to sell product so they can continue to be employed, so that the stockholders will continue to invest. It's called business, ladies and gentlemen. And so what you do is you take something unique about your product and you advertise it. Even if it's false, as long as there's lots of something associated with your product, then that's what you advertise, especially if you uniquely have a lot of it. And so unique position is called. It's not a conspiracy, okay? It's just people making money. They don't dislike you and your family. They're just trying to make money. If I mention meat, what is the unique position? You know, Mary.
Protein.
Thank you, Mary. If I mention dairy, what is the unique position?
Calcium.
Calcium.
All right. If I mention fish, what's the unique position?
Omega-3.
All right. Well, you need to know, and I challenge you to research it. I've spent 47 years researching it, and I've not found a single contesting bit of information, including all the scientific data. I mean, I once had a passion for studying William Rose's work, who discovered the last two amino acids, and the other inventors of the discoverers of the various amino acids, all the way from Osborne and Mendel when they did their rat experiments in 1917, all the way to when Rose finished his work in the 40s. You know, that stuff I could find nothing that said you could design a protein deficient diet based upon any natural diet. Anyway, the problem is protein excess. So I wouldn't worry about it. The other example that I like to give, a story that I've told to many of you, and I'd like to tell in detail. It's a great story, but I'm just going to tell it in brief. Is McKeel Henhedy was a nutritionist at the turn of the 18th to the 19th century. Okay, he lived in the early 1920s. He lived during the time of World War I. And what he did is he designed a eating pattern for the Danish. Okay. Because they had the German blockade. England set up a blockade where they prevented supplies from getting to Germany, and Denmark is right in the area where this blockade occurred. So they were destined to be deprived of food. And what Mikhail Henhedy did during World War I is he convinced the population of 3 million Danes to eat a diet that once the animals ate, a diet of potatoes and soybeans and grains, and they let the pigs and the cattle starve to death. And, you know, when he was designing the diet, researchers knew then, that the need for protein in a human being was so low, they didn't even have to consider it. That was 100 years ago, ladies and gentlemen. All the science since then says the same. You know, foods and people haven't changed in 100 years either. So anyway, you can't design a too low deficient protein a diet deficient in protein. It's just impossible to do. The same thing with calcium. You know, that's the other one that they advertise to death to you, and you need to know you will not find. I have researched, and I've spent months looking for it. You will not find a single case of calcium deficiency due to diet on any natural diet. You know, they can make up synthetic diets in a laboratory, you know, feed you, like I say, table sugar and water. Yeah, that's protein deficient, calcium deficient, vitamin A deficient, fiber deficient, everything deficient except for sugar. But otherwise, you can't do it. No natural diet will allow that to happen. Our needs are so low and the food is so sufficient. It never happens. That's why you've never seen a case of protein deficiency. I know you haven't. You've never seen any of your friends or relatives have amino acid deficiency. It was such a problem as the meat and egg and dairy industry advertised. People would be filling hospital beds with protein deficiency. Move over COVID, move over flu, move over respiratory viruses. We got protein deficiency. Excuse me. No such thing. Anyway, I assume that was the question. You don't have protein.
That was great. Thank you. So just eat the food, eat a starch-based diet. You'll be fine.
You cannot miss. The only thing you have to worry about is getting too much protein. And you can do that, I think, by eating too many beans, peas, and lentils. And that's why we encourage you to pick other starches to center your diet around besides beans, peas, and lentils. They're about 30% protein, which is the same as beef. But the negative impact of beef is at least 4 times as great in various parameters as would be beans. Same amount of protein, same number of calories, just a different kind of protein. And so, I do have some reservations about bean, peas, and lentils, particularly in my patients who already have diseases that are involved with protein, people with liver disease or kidney disease. They're people I really want to be careful about beans, peas, and lentils and other high protein foods. Lettuce, that's another 38% protein, lettuce is. So awesome.
That one's really hard to believe.
Yeah, well, look it up.
Okay,
Anyway.
thank you. Are you
Okay.
ready for the next question?
I'm ready.
Okay, this is from Lasheray. Wondering how to heal my indigestion to tolerate rice vinegar. I love veggie sushi rolls, but I notice I have painful GERD after eating it.
I maybe time. Maybe time the stomach will heal and you'll be able to tolerate the vinegar. But vinegar is a lot of citric acid. And that may be troubling to you. What do they make vinegar out of? Apples, right? Well, they make a lot of things.
Rice vinegar is made from rice, fermented rice. Apple cider vinegar is made from fermented apples.
That's maybe why the Adventists said no fermented food.
Yeah.
They could have. But these things have a lot of acids in them. They're all surface acid. They're in the juice. There's citric acid and acetic acid. These are acids and they burn. Whereas if you were just eat the rice or just the apple, it wouldn't be a problem at all for you. It's the juice. And this confuses people when we talk about acid-base balance. Even dietitians, I run across dietitians who just are dumbfounded when I tell them that
citrus fruits aren't high in acid.
Yeah,
right?
citrus fruits are alkaline.
Yeah.
When I tell them that lemons and limes and tangerines and oranges, they say, no. I took my pH meter stick and I stuck it in the orange juice or the juice of the orange. That's what you measure with the stick. And it registered a acidic pH. Well, that's because you're measuring the surface acids in the juice. When you eat the whole orange or lemon, you grind up all this bulk material. And a lot of that material is very alkaline. And so when you get done chewing and digesting, what happens is you've taken in an alkaline load. And you want to take in an alkaline load. In other words, you want to take in a diet that is alkaline. You want to take in a diet that has a pH above 7. The human body has a pH of around 7.4. If you're lower than 7, then you are in an acidic condition. You die. You've got to maintain that pH almost perfectly, or you die. And so what happens is you eat acid. Real acid, not just the stuff on the surface of the food. Not that's just the stuff the dietitian is measuring with their little stick.
So what's high in acid? Cheese?
It's the most acidic of all.
Yeah.
The acid load you get from cheese is greater than any other food that I can think of. And this acid load really counts because it has to be neutralized by the bones. Well, the kidneys work hard to try and get rid of some of the acid. They can't keep up. So you create this metabolic acidosis by eating animal foods. I can give you some numbers. Cheese has an acid load of 10. The positive acid load of 10. Fish, 9. Chicken, 8. Beef, 7. Rice, 1. Beans, 1. Tomatoes minus 17. They're alkaline. Spinach minus 56. Potatoes minus 5. You see, our diet is alkaline. When you mix it up and make minestrone soup out of it. How about that pea soup you're going to have tonight?
That's right.
Yes, I think so. That's an alkaline soup. So we eat an alkaline diet, which puts you in a situation where your bones don't have to dissolve to correct the acidosis that occurs as a consequence of eating animal foods. Animal foods are high in protein. You know that. You've already asked me that at least once in the last few minutes. indirectly.
So rice vinegar is acid.
But but not, it wouldn't be, you take the original rice, well, with rice is slightly acidic, but say you make it out of apples,
Yeah.
then, and you chew it up, the load that you get is alkaline. If you just take and measure the juice,
Yeah.
you know, which is concentrated in citric acid and acetic acid.
But all juices are kind of acidic. I mean, don't
Yeah.
you tell people don't drink juices because they're irritating to the stomach?
Yes, they are, because the juice is irritating. And that's what this person is complaining about, is the irritation from it. But otherwise, you know, these foods, your fruits are a very healthy part of the diet. And they're a very alkaline part of the diet too. You know, so don't be fooled by the surface acids. They're insignificant, except they, as Mary mentioned, you know, when you consume them in concentrated amounts, which you would in this rice vinegar, I mean, that's just concentrated acid. You know, they took the juice, that's just full of citric and acetic acid, and they put it in a bottle for you. They left all the alkaline part of the rice and the apple and the whatever behind. So it goes against a rule that we have, which is you don't eat damaged food. You don't eat isolated concentrated nutrients. You eat the food whole and as little damaged as possible, which would be, I think, reasonably cooking. You know, we put some restriction on blending, grinding foods. There's a whole segment of the population that believes that the way to counteract all of the bad food that they ate is to juice. And so they get into, you know, they buy one of these expensive mixers and they take these perfectly good fruits and vegetables and they beat them 1,000 times with a steel blade. And they destroy a lot of the quality of the fruit and vegetable. Now, put this in perspective. Most of you are healthy enough to drink some juices, but some of you aren't. You know, if you're trying to lose weight effectively, then consuming juices is not the way to go. You've released an awful lot of simple sugar by grinding up the fruit or vegetable. If you have high triglycerides, which are sensitive to simple sugars, juice is not part of your diet. But if you're just, you know, the average Joe or Jane, and everything's, you know, going along pretty good, just got, you know, 20, 30 pounds to lose and a little constipation to correct and maybe a touch of rheumatoid arthritis, have a juice. Ain't no big deal. But it's not better. And that's what we got to get straightened out. And you got to stop looking for return of your health by doing anything but correcting the problem. You've got to correct the food. You can't take a bunch of supplements. You know, running to the doctor is only temporarily going to get you out of trouble. You know, grind it up. Your food is not going to be strong enough to correct the problems. You got to fix the food. You got to eat a starch-based diet with fruits and vegetables.
Well, you know, now they have those ads on TV about fruits and vegetables and little pills.
Yeah. That's all they got.
Yeah.
That's all they got is fruits and vegetables.
Yeah. So you don't have to eat all your fruits and vegetables. You just have to take a little pill because all the concentration of fruits and vegetables are in the pill.
Do you remember the name of that company that we were going to invest in?
Plus.
Yeah. Well, I tell you, I would have been a gazillionaire. I'd have had my own Lear jet. If I would have listened to these people when they first started Juice Plus, they came to me. They wanted me to be one of their founding members. I wouldn't have had the fun I'm having here with you folks tonight, but my whole life would have been different. I would have been wealthy beyond any belief I ever had, but I didn't believe it. I knew that when you concentrated the fruit or vegetable, you didn't make it better. I'd have to say Juice Plus and these other berry, whatever they are, because they do advertise it. They're just whole fruits and vegetables. All they've done is taken the water out and compressed them. They're probably the healthiest way to get more nutrients. But what do you need more nutrients for? I mean, how many of you have scurvy, beriberi, pellagra, protein deficiency, calcium deficiency? Excuse me, ladies and gentlemen, you're treating problems that existed, 70 years ago and more. These don't occur these days, except maybe skid row alcoholics whose diet is alcohol. But otherwise, you're wasting your energy, you're wasting your money stop wasting your money. Get yourself well by eating very inexpensive potatoes. I bet some of you out there, I can cut your food bill by 90%, especially if you go out to dinner a lot. 90%. In this time where you're worried about inflation, you're worried about paying the rent and putting shoes on the kids and paying for private schools. Would it be nice to cut your food bill by 90%? I think on average, you can pretty much expect somebody who eats at home to cut their food bill by somewhere between 40 and 60%. If you don't eat out at all, you just change the food to, instead of
big bags of rice and big bags of potatoes and big bags of dried beans are really inexpensive. And you can make all kinds of meals out of it.
Did you hear in the paper some good news?
No, ma'am, maybe.
The good news are eggs have become almost
Oh, yes, eggs are.
almost so expensive nobody can buy them. They had a picture of one of the cartoons was a golden egg.
Oh, yeah, I saw that.
In today's paper. So, bravo for the eggs. Finally getting a price they deserve. Well, really.
But why are they becoming so expensive? It's because they all have bird flu, right?
The fields, And of course, this presents a problem for us because some of the viral infections we've had in the past have been from birds. And in the future, they will be from birds. So we will catch these viruses from birds. So.
Okay, next question, a new topic. This is from Michelle. She says, my mom's doctor says I need to have colonoscopies because my mom had colon cancer surgery 7 months ago. I've never had one and I don't plan to, but can you comment on colonoscopies?
Right. Well, if you lived in Canada, the Canadian Task Force on Preventative Medicine would have told you as of the year 2016 to not get a colonoscopy. That's because the data shows that colonoscopy is, it doesn't prolong life. There's some evidence, and it's sketchy, that colonoscopy will result in a lower risk of dying of colon cancer. But, they may save one person from colon cancer, and then they kill the next person on the operating room table from a perforation or an anesthetic death. So as far as keeping you alive longer, it's not going to do it. Now, the U.S. Preventative Services Task Force, they came out just recently, 2018, I believe, was when they came out with their data. And what they said is there's 7 ways to detect colon cancer. And the reason you detect it early is because you have less risk of dying of colon cancer, not less risk of dying overall. Remember, when you find these problems, you present additional risks from surgery, anesthesia, chemotherapy, et cetera. Okay, so the U.S. Preventative Services Task Force, official recommendations are to get screened sometime between the age of 60 and 75. And they say you could do one of 7 different things. One, or a couple of them are to check the stool for blood. Another one is to check some genetic material. Quite inexpensive. Then there's a new one out. It's called Cologuard, which is not inexpensive. It's $600, or at least last time I looked, it was. And that checks for genetic material, and they find polyps and people with colon cancer. And then you can have a sigmoid exam, and you can have a colonoscopy, or you can have a barium animal with a sigmoid exam. So you've got all these choices, and what the U.S. Preventative Services Task Force says is they're not ranked in any particular order. In other words, one's not better than the other. So you introduced another factor here, and that is that your mom has colon cancer. Well, your mom has colon cancer. That's important to know. But if the reason is because you have the same genes as mom, it is unnecessary, worrisome information that will lead you nowhere because you can't change your genes. The reason you have a higher risk of colon cancer because your family has a high risk of colon cancer is because mother taught you how to eat and cook. And, unfortunately, I would guess that you're of an age where you've spent, 20, 30, 40 years eating mom's cooking. So if you could be saved by getting a colonoscopy, that'd be one thing. I don't recommend it. At most, I would recommend one of the other less costly, less invasive, less dangerous tests that I just talked to you about to discover whether or not you have an indication for further testing or treatment. But, they sell colonoscopy. Why do they sell colonoscopy? Why is it the gold standard in the United States, where it's outlawed in Canada? Why? $3,008 on average to do one. $3,008. Check your stool for blood is like $3 to $40, depending on which test you take.
Yeah, but people don't think about that because their insurance pays for it.
Well, then they ought to also think about the drive to the hospital. The half a day at least they have to spend in a hospital or
and the prep beforehand.
Oh my goodness.
Yeah.
People say that that's worse than having the procedure done. Is the bowel prep you have to take to clean out the bowel. Anyway, that's how the men and women make their living, is they stick an 8 foot tube up your butt, whereas a 2-foot tube does a better job. There are a sigmoid exam, I think, is a reasonable thing to do. What I recommend is similar to what people around the world recommend who are experts, and that is that you get a screening done somewhere between the ages of 60 and 75. If you're older than 75, it's too late. You're not going to live long enough to reap the benefits. Somewhere between 60 and 75, you should have a sigmoid exam, one. And/or you should test your stool for genetic material or stool for blood. And sometimes that can involve as many as tests annually for 3 years. And then you don't do it anymore. Why? Why don't you do it anymore? Well, you say you're 60, the lowest limit. Say you're 60 when you get this exam and everything's clean. Okay? You don't have cancer, at least any cancer that's going to kill you. Let's assume the doctor did a good job with the examination, but they miss as many as 40% of the polyps. So, you ought to think again when you think about what's going to be found. Anyway, say it's perfectly clean at age 60, and the next day the cancer starts. It starts with some proliferation, then some hyperplasia, and then some cancerous changes in the cells that take place in the lump that's formed called a polyp. And then the polyp degenerates a bit. It takes 15 years to make the transition from a normal colon to colon cancer. All right, now you're 75 years old. It takes another 15 years to kill you. You're now 90 by the time you reap the benefits. And think about it for a little minute, ladies and gentlemen. Your doctor is asking you to risk your life today. People die from colonoscopies. To risk your life today for the theoretical possibility that you're going to be advantaged 20 or 30 years from now. Listen, I spent my time gambling, but that's not a bet I would take. How about you? How about you? You need to know the facts. You read my August 2010 newsletter, and then there's a follow-up on colonoscopy that I did in the year 2017. So, it's there. I'll talk you through it. Nothing's changed. I've not found a doctor, a GI specialist, or a scientific article that in any way disputes what I'm telling you, except, and I still have a little work to do on this article. There was an article last month that suggested that for the first time, getting a sigmoid exam, which is the 2-foot tube test, not the colonoscopy, but the sigmoid exam, actually improves overall survival. And I think because your risk of killing people is so low with this 2-foot flexible tube. You see, whereas you do an anesthesia, you do a 6-8 foot tube, you're putting your patient at extreme risk. And you have to use an anesthesia with a with a signal. You just lay down, do it, get up, go home. So you eliminate the reasons that people die. And that may be why this research paper that came out that I've given a couple reads now suggests that doing one sigmoid exam will cause you to live longer by a tiny bit of time, not much. Maybe I'll do that for prep next time.
Okay,
What do you think?
I'll try to remind
You
you.
remind me. I got to read that paper a couple more times before I really get a grasp of what's going on. And plus, I usually like to see the letters to the editor, which often appear in the same journal, but sometimes you have to wait a month or two before people who are real experts come back and say, this is the way they got the results, and it wasn't exactly honest. Or, they're really great results. You ought to really believe these. So, heads up, next Sunday, I'll try and remember to give that particular article a better look.
Great. We look forward to it.
Let me end with this woman who asked this question. Yes, you need to take action, strong action. You need to stop eating the way that this loved one in your life ate and got colon cancer. Yes, you do right now. Are these polyps reversible? Yes, they are. Is cancer reversible? Well, the American Cancer Society thinks you can change the course of the disease. They published in February 2015. The American Cancer Society published the results of studies that show that when you have cancers like colon, breast, prostate, if you change your diet, you will live longer. And they told doctors they need to include this as part of their patient visit. You must tell the patient to eat the kind of diet that Dr. McDougall eats. They don't really say that, folks, but they're heading in that direction. And then you need to sit back and say, well, why not what Dr. McDougall recommends? Why should I do any compromises? I'm facing a potentially deadly disease. And you ask me to include a little bit of chicken. You ask me to,
Because nobody can eat the way we say.
Right. Yeah. What you ought to ask as a consumer is, Doc, I want the best treatment possible. I don't want to hear about how you eat or what companies you own stock in or what you believe and were taught all the way through school by your parents, et cetera. I don't want to hear that. What I want to hear is the best treatment you know about. Don't give me a half a shot of penicillin to cure my pneumonia. I know it takes a full shot. I know a half a shot hurts more, and you feel sorry for me because it hurts a little more. But I don't want to die of pneumonia, so give me the whole shot. Okay, and that's the way I feel about the food. Is why don't you get the whole shot? We teach you the whole shot. There are no compromises in the McDougall program. And you know what? I knew I had to design it this way when I did 47 years ago, because I knew the compromises would catch up with me. I knew they were wrong. I thought, well, maybe you'll be more popular. And maybe I would have been. I mean, you think about those people who offer compromises.
Yeah.
All they do is ask you to starve or to eat so much meat and dairy that you become ill, like the low carbers. Or to take a shot every day or every week under the label Ozempic, a diabetic shot, which costs like $1,400 a month, $1,400 a month. Hey, doc, I want the treatment that works best that costs nothing. You guys, you deserve better. You really do.
Thank you. Next question. This is from Lily. What would cause an occasional red patch on my face? Allergies, eczema, your thoughts?
Well, it's interesting. I don't know. I'm trying to think of, maybe you're getting a touch of acne rosacea or regular acne or early lupus. I don't really know. There are probably lots of things, but maybe you just get a hot flash, or something causing you.
Kind of depends on what kind of a redness it was. Is it a surface irritation, or is it just a?
The fact that it goes away suggests that it's a vascular thing. The blood vessels dilate and you get a kind of that's what I'm thinking, not something long-term like lupus where you get a butterfly rash or any serious, most of the things you mentioned, eczemas, et cetera, are going to be there a long time. They're not going to just disappear. And I think I heard you say it comes and goes. Maybe not.
Yeah, I think so. So maybe it is vascular. Okay, next question. This is from John. Can you talk on the subject of varicose veins and if surgery to remove them is beneficial?
Yes, I can talk about it. I'd love to. Mary, Mary and I met in an operating room over 51 years ago. And she was a surgical nurse and I was a surgical nurse technician. And, for a time there, she worked on general surgeries, and all my time, where I was trying to earn money to go to medical school, I worked as a general surgical nurse. So I saw lots of operations, including varicose veins. Do you remember those?
Oh, yeah.
Tell us. I'll fill in the details because I
remember they do a little cut at the bottom of your leg, and then they would take these hemostat, and they also have to cut them at the top, and they take the hemostat and they pull the whole vein out.
Right, but what do they stick in the vein? Because you can't reach your hemostat all the way from your ankle up to your groin.
Well, it's a little tube, like
the catheter,
yeah, tube that went all the way up.
Right. So what they do is they take this wire and they tie the top of the vein in the leg. They would tie it onto the top of the wire, and then they make a cut in the bottom, where they inserted the wire. So you can insert the wire right from the vein in the leg all the way up through the groin. And so they would tie the vein onto this wire, and then they would, at least one person, if not two or three, would pull the vein out.
Yeah.
I don't think they do that anymore. Do you think so?
Probably not. Can't they put? Don't they inject them with saline and they shrink? Or something like that.
Yeah, but those are superficial veins.
Oh, okay.
There's deep veins. Not the deep ones.
Okay.
There are deep veins, and then there's superficial varicose veins. The superficial ones are generally tiny. They look like little spider webs on your legs. And they're treated effectively by lasers and also by sclerosing agents, where they take a syringe with a tiny needle on it, and they inject a sclerosing agent. You can imagine what that means, but it could be like concentrated salt. And what it does is it causes the vein to become inflamed and to shut down and to collapse permanently. And with no blood in it, you don't see it. It's gone. And that's a very effective way to do it. And anything in between, I don't know what they're up to these days. But once you get varicose veins, that's it. They don't go away. No, they're permanent structural changes. So how do you get varicose veins? It's due to straining. Okay, it's due to straining. And the most common and severe form of straining comes as a result of constipation. What you have is this vein that goes all the way up to your heart and drains into the heart through the vena cava. So you got this like 5-foot vein that supports a column of blood. We're talking about a tremendous amount of weight when you've got 5 feet of fluid. To distribute that heavy column of blood, the vein has valves that start appearing in the legs. The valves, what they do is they when the blood moves up towards the heart, they collapse. I think I got to do that like this. Anyway, they open up as the blood moves up.
They're like little steps.
Yeah, like step ladders. And then as the blood's not allowed to flow back down, so they come back together. They close. The valves do. And so in a stepwise manner, they break up this high pressure. And that's fine, except for by grunting and groaning and straining, primarily constipation, you end up putting heavy pressure on these valves and you destroy them. And now they're incompetent. And now you've got this great, huge column of pressure on your veins, and you develop something that's referred to as little blue worms. And that's how you get them. So they're permanent structural changes. But if you stop grunting and groaning and straining, you're going to stop the processes that cause the veins to get bigger and worse. And of course, you know how to do that, right? You do. I know you do. I know you do. Okay.
Okay, thank you. We've got 5 minutes left. This is a good question. This is from Novi Pam, wondering if your diet has changed over the years based on new research that's come out.
Sad to say, from some of my detractors, it's not changed. You know, I worked for 6 years to put together my basic medical plan and my basic diet. And when I say I worked, I mean, if Mary told you what a fanatic I am when it comes to reading research, you know, it's pretty hard to understand somebody who doesn't have that kind of passion. So I did a lot of thinking, did a lot of research. I was in an ideal part of the world. I was in Hawaii, where people ate differently. I had the plantation experience. I've told you about it. You know, I saw my healthiest patients living on rice and vegetables, and my sickest patients living on a well-balanced diet. I had all that experience. And because of that, I put together the best diet I know. And I did it that way too, is I said, okay, let's start out with just starch, like potatoes, and a few vegetables. Let's add something to it and see if it makes it better overall. So let's add some dairy, which everybody tells you need for calcium, which even by that time I knew you didn't. But let's just say, okay, so you added that, you got the calcium, but you also got a whole load of infectious agents. It's the dirtiest food out there is dairy. You know, you get listeria and salmonella and mad cow prions and just on viruses, leukemia viruses, AIDS-like viruses. They're just dirty stuff. And it's fiber-free, it's constipating, it's deficient in essential fats. Why would I add milk to a good diet? And so I went through as a mental exercise, and I added all the things that everybody had taught me in the past were so important to include in the right diet. And what I found out when I took all the pluses and minuses is the negatives so outweighed any possibility of positives. And most of the positives I was lied to. You know, I believed that we needed protein. I once did. Oh, excuse me. We needed meat to get protein. We needed large amounts of protein. I used to believe that. We need protein, of course. I used to believe in the importance of dairy for calcium. I used to believe that. You know, I came from the same place you did. But I took the trouble to research it. And the answer is no, I have not basically changed much. The thing that has changed is we started out in our cooking. You know, I mean, when we first started, it was tough for us to figure out what to eat because nobody had ever done it before that we knew of.
Yeah.
And so, you know, it was really Mary that really did the bulk of the changing once I'd figured out what we were supposed to do. And maybe sometime, maybe next week, we can tell you how we went through that. It was kind of comical. It took us a couple of years to figure out, you know.
Well, now there are so many recipes out there that follow our guidelines that
Thousands.
anybody could do this without even thinking about it.
Yeah. So I hate to sound like I'm bragging, but I got it right the first time. But I put a lot of work into it. And I haven't had to change, and nobody's told me any reason I had to change at all, ever. You'd be amazed at the little amount of confrontation that I've gotten over the years. You know, virtually none to my face.
And we've had thousands of people go through our programs and just, you know, find us online and send us emails about how well they've done.
Yeah.
Just following a starch-based diet.
You know, they get to see these if they belong to the newsletter, I guess. They get to see these amazing Star McDougall that you put out, you and the team. I just, you know, they just keep coming and coming and coming and getting better and better and better. So you got a program, we're running one right now. So it's a little late to sign up for this one. And you're going to do another one when, Heather?
Probably in March.
It is. Our next one's in March 3rd.
Yeah. So you want to think about, you know, signing up. It's It's something that you're going to take, you're going to look back and you're going to ask yourself, why didn't I do this before? Long before. Why did I have to put up with all the nonsense? This is so easy, so enjoyable, so beneficial. I know you will. You know, I've taken care of 6,000 patients in a live-in situation, 6,000. Taking care of more than 12,000 patients total. I know, I've seen it over and over again. And believe me, if there was a better way to do it, I'd do it. Well, there is. We have these little pills that will sell you. The diet doesn't work unless you buy these little pills. They have M's on them. They're only about, I think we charge like $10 a piece now, and you got to take 4 a day. Otherwise, the food doesn't work.
He's kidding. All right. Well, we've run out of time at 6 o'clock. That was great. Thanks,
All
Mom and Dad, Dr. McDougall, and Mary.
Next Sunday.
Next Sunday, 5 o'clock. Tell your friends. We're building a crowd. Well, more and more people seem to be interested every week. So as long as you're interested, and as long as Mary and I have the answers that you're looking for, then we're going to keep doing this. Otherwise,
That's a good place for people to come and ask their medical questions.
it's free, and you don't have to be threatened in any way. You just gotta sit there and write them down and send them in. Yeah, it's cool. I wonder how many other people do that.
You mean a show like this?
Yeah, I wonder how many
not too many.
other diet so-called diet doctors do this, or medical doctors. Probably not very many. I don't think I've ever heard of any. Oh well.
Well, we sure enjoy it.
Yeah.
Well, we do too, Heather, and that's why Mom and I keep doing it. It's because the impact, the return to us is huge, and of course we don't get to know you in this format, but some of you do end up coming to the 12-day program, and then we get to know you. We get to know your name. We get to know who you are. I really work with you, and it's great.
Okay. Well, thank you for this hour.
All
See you
right.
all next week.
All right.
Have a good week.
Have a good week. See you next week.
Bye, everyone.